Well, hello, 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 hello. welcome to SHEM Ministries. What is SHEM? Souls Honoring Elohim's Mandate. And tonight, this is our SHEM 2 night. It is a spiritual, healthy, enlightening mandate ministry. And guess what? I'm in my special spot. I am in the place that Pastor Devlin he knows if he can't find me in the house, he knows where to come look for me. This is my little comfortable spot, and it actually was a place that I didn't have to worry too much about the lighting, so we tell God thank you. So please, make yourselves feel welcome. I am Dr. Anna Shaw Devlin, and I am a family nurse practitioner who loves God's people. Loves God's people. When I say that, I say to you that it is a love that only God can give. I am not going to sit here before you and say, oh, I've been like that all my life. No. The best people sometimes are those people who didn't start out like that. Anyway, but let's move off of me. The reason I did not begin tonight with our normal prayer is because I've got a lot to cover. So we are going to expedite things, and we are going to ask God. First of all, we're going to thank Him. Father, we thank you and we praise you for a day that we have never seen before. Father, we glorify your name for counting us worthy to give us another day in your kingdom, God, to glorify you. Yes, we live in the earth, but my God, my spirit, my heart, my soul, my mind, all of me as an empty vessel belongs to you in your kingdom, in earth as it is in heaven. I have to tell myself that every day. Live with Him in His home and just visit earth. That is my coping mechanism. This earth, we think of it as our home. I'm just a visitor. Now, you can let this be your home, but I changed my way of thinking. I belong with Christ in His kingdom. I have a room with my name on the door. Glory be to God. Can't nobody walk through my door but me. Because see, I've been through hell and high water to get my name on that door. So where I am right now, I'm just visiting. And guess what? I didn't even take all the clothes out my suitcase. Because you know what? I ain't staying here. And we need to stop thinking about leaving this world as a bad thing. I love my family, but guess what? I've done everything that I feel that I could do right by them, to leave them. If I left tomorrow, or if I left tonight, leave them in a good place. I've sowed seeds. So anyway, let's move on. All right. So tonight, our topic is, and this is something that the first time in your life that a D is a good thing. So tonight we're talking about how to pass with a D+. You mean to tell me that I've been striving for an A but all I need is a D. Oh yes, tonight you only need a D plus to pass. Okay, now those of you who already have, we're talking about vitamin D tonight. So those of you who already have a sufficient amount of vitamin D, so an optimal vitamin D level, which is greater than 30, I'm not going to make you take a test. I'm going to tell you, go straight to the final exam. And the only thing you have to do, have you ever taken those tests where if you got to go through each question to know that if you don't go through each question and follow the instructions, all it says at the bottom is sign your name. But if you want to be one of those that have to go through each question, so be it. Okay? But tonight we're talking about vitamin D deficiency. And I think this is something that I would say I didn't know much about until I became a nurse practitioner, because doctors didn't talk that much about vitamin D. And I even actually have an article here from 2009 that talks about, so it's not been something that we've known a lot about, research and this, that, and the other. But if you've noticed lately, big talk about having sufficient vitamin D levels, and that is because there are so much research that has gone into the link between not having enough vitamin D and our bodies like falling apart, or different disorders, especially autoimmune and inflammatory disorders. So if you know anything about inflammation in your body can cause a lot of havoc and mess up a lot of stuff. I don't care how healthy you are. Inflammation can mess you up in many ways. So vitamin D is linked in many ways and believed to be linked because of inflammation in the adult. But in children, and let's just talk about that, because you remember it was always a big talk about vitamin D fortified milk. Okay, because what is milk? Milk has calcium. And then they learned that if you don't have enough vitamin D, you can't absorb calcium. So it's not, if you want to keep your bones strong, you got to have adequate vitamin D. You can drink all the milk in the world, right? But you're not going to absorb it. So let's talk about how to pass with a D plus. And having a D plus is when you have adequate vitamin D. So let me tell you what I'm going to do while we're talking. Let me hopefully not accidentally. Oh my God. Did I not upload all my photos? Ooh. I think I got enough. Wait a minute. We'll be okay. Let's see. How about this here? Yeah, let's leave that up for a little while as we talk. So I'm going to talk to you, and then you can read what it says about vitamin D. So vitamin D is an essential vitamin that helps regulate calcium and phosphorus in the body. Now, calcium and phosphorus, I don't know if I told you this before when we were talking about renal disease, but calcium and phosphorus are married. And their marriage is so strong that they keep our bones strong. So calcium and phosphorus are what makes strong bone. But we got to have the vitamin D because it plays a major part in maintaining proper bone structure. It actually holds them together and keeps them strong so that one doesn't decide to depart from the other. Okay? All right. I'm going to take something that can be very complex and I'm going to try to make it as simple as possible. You know I always do that, okay? So just bear with me. So there are different forms of vitamin D. And if you see my little slide up here, I actually, did it not all get on there? I think it did. Yeah. All right, so where it talks about D3 and D2, okay? So, and I've got on there where it says cholecalciferol is vitamin D3 and vitamin D2 is ergocalciferol. Okay, yep. So there are different forms of vitamin D, including ergocalciferol and cholecalciferol. Don't worry about all of that. It's up there. D2, D3, okay? Vitamin D is also found in fish and eggs and fortified milk. Has to be fortified. Fortified. You know what that means, okay? It means it wasn't there. They added it. It's also made in the skin when exposed to sunlight. Now, I didn't say that you have to lay in the sun. You can get sun without laying in the sun to the point where you get burnt or increased risk for skin cancer. Because remember, we did a long talk on skin cancer. It only takes about 10 to 15 minutes of sun exposure to get enough vitamin D. But the issue is you need to get it regular basis. And then over time, it can, your vitamin D levels can drop. And a lot of that is age and, anyway, so age and color of our skin. So one of the natural things that a person of dark skin, they have melanin in their skin. So the darker you are, let me just say it nice. Let me quit trying to be cute. The darker you are, the odds are you're more vitamin deficient. Okay? Because your dark skin repels ultraviolet light. And if ultraviolet light is what changes or causes us to have vitamin D, you see what I'm saying? Okay. All right. So, because it is made in the skin when exposed to sunlight. During periods of sunlight, vitamin D is stored in fat and then released when the sunlight is not available. So, if you don't have a lot of fat stores, you are at increased risk for vitamin D deficiency. Okay? All right, let's keep going. Vitamin D supplements are commonly used to treat and prevent vitamin D deficiency. People who don't get enough sun and, like I said, people who are 65 years or older are at risk for deficiency. People also use vitamin D for weak and brittle bones. Okay, we're going to talk about the osteoporosis and multiple things that can increase your risk for osteoporosis. Calcium absorption. The older you are, the lack of hormone. Listen, it can get so complex, especially for women who are postmenopausal. Increase the risk of osteoporosis from the hormones that are no longer being produced when you ovulate, okay, as well as your age, as well as the potential lack of exposure to sun. And if you're diabetic and you have renal disease, that's another story, okay? I'm going to keep it simple. But what I do, I'm going to show you a diagram that is really going to explain a lot of this. But let me keep reading real quick. All right. And I also have a slide that shows you where, remember I told you I was going to start showing resources and where things come from, like WebMD and National Institute of Health, or some of the main sources for, and I do have some evidence-based article. I don't know if I put that one on there, but it is the Annuals of Epidemiology. Okay. All right. So people, we talked about vitamin D for weak and brittle bones, heart disease, asthma, hay fever, and many other conditions, but there's no good scientific evidence to support many of these uses. The proof, the jury's out. Okay, I mean, there's much research in progress, but those of you who know about research, it takes 10, 20 years of studying something sometimes to really get good research. And the larger the sample size, the better, okay? The evidence, to make it evidence-based, the more selective you are. I mean, the least selective, the more randomized trials and things. All right, so there is no strong evidence to support using vitamin D supplements for COVID-19 either. However, I will say this. They did identify that people who had normal vitamin D levels did better. Remember what I said about inflammation. Okay, I think inflammation is one of the key things. All right. But it is important to maintain healthy levels of vitamin D. This can be done by taking 400 to 1,000 international units of vitamin D daily, or spending 15 to 30 minutes in the sun each day. See, the thing is, we're sporadic in what we do. So you might gain a little bit and then you lose a little bit, right? You gain a little bit of sunshine and you lose it, especially in the winter. So we're coming off of the cold season, the winter, and you could still actually get vitamin D conversion from sunlight even in the winter. Because many times it's cold, but the sun's shining. You know what I'm talking about. So you got to sit in front of a window and read a book. Okay. All right. Uses and effectiveness. I don't know if I really want to get into like hypoparathyroidism and all that stuff. The main thing I wanted to tell you was that you have to have vitamin D for calcium absorption. And taking all that calcium in the world without being adequate with the D is not going to help you. That's the main thing that I wanted to say to you. Now, I do want to mention about the bone disorder that occurs in people with kidney disease. Tell me why. Because what did I tell you about the number 1, number 2 reasons for renal failure were? Diabetes and hypertension. And so because there's so many people with diabetes and hypertension, I'm trying to paint a picture to say all the reasons why we need to protect our kidneys. All the reasons why we need not to become diabetic and not have high blood pressure. So that's the reason you're going to hear me go over and over and over again. But there's a disorder in people with kidney disease called renal osteodystrophy. And it's where taking a specific form of vitamin D called calcitriol by mouth helps to manage low calcium levels and prevent bone loss in people with kidney failure. Because what happens is the kidneys have a active hormone called calcitriol, which when that level gets low, so if the kidneys are failing, calcium and phosphorus are released from the bone. So if the calcium is low, phosphorus levels are released, so they get high in your bloodstream. Calcium gets low, and your bones start to get weak and brittle. So you can have brittle bones from kidney failure. And you can be of a certain age, postmenopausal, 65 years old, and have osteoporosis. So are you telling me you can have a double whammy with bone loss and bone disease and renal failure? Yes. It's very difficult to manage sometimes. Yep. So anyway, I'm not going to get into that, but it is a vicious cycle of keeping your phosphorus low, keeping your vitamin D adequate, keeping your parathyroid gland from releasing, sending a signal that says, let the calcium in the I'm telling you, let me not go there because it is very complex if you really don't have to go there. And I want to stay focused on the main reason we're talking today, and that is about vitamin D2 and vitamin D3. Also, I need you to know that bone loss in people taking drugs like steroids, corticosteroids. So if you have, that's when we were talking about the asthma, okay? So if you have really bad asthma, or you have COPD, or you have a inflammatory disease, an autoimmune disorder, something where you have to take steroids, are you telling me, oh my gosh, I'm an increased risk for bone loss? Yeah, you are. Oh boy. Dang if I do, dang if I don't. I just don't know what to do. So guess what we're doing? It is the more you know, you prevent things. You cannot wait on them to come knocking on your door, because by the time they knock on the door and say, let me in, they are not coming alone. They're bringing family and friends. So they come together. Okay? They all come together. The high blood pressure, the metabolic syndrome, the diabetes, the high cholesterol, the vitamin D deficiency. They're all coming to your house. So I need you to start looking down the road and saying, I see a pack of people coming my way. Oh, you ain't getting up in here. I'm going to start boarding up the doors, boarding up the windows. It's kind of like storm preparation. You know it's hurricane season. You know you've got some shingles loose on your roof, so you go on and you get it fixed before the storm comes. Or you know you got this tree leaning in your yard and you go on and get the limbs cut down because it's hurricane season. You know the storms are coming. Okay? Same thing. You know, if you live long enough, and and the odds are the first 20 years of your life, you cut the fool and enjoyed yourself. You ate whatever you wanted to eat, right? Well, let's say 25 years. Let's do that. The first 25 years of your life, oh, you ate every kind of steak with all kind of gristle and fat. It was delicious, because everybody know fat is flavor, okay? You ate what you wanted, all the cakes, all the pies, all the candies. You drank all the liquor you wanted. You did all these things you wanted to do. And then the liver and the kidneys and the pancreas and the blood vessels and all of them started to say, whoop, started accumulating fat around the abdomen, this, that, and the other. Okay, you feel me? But you had 25 good years of doing what you needed and wanted to do. So now it's time to do differently. Okay, so I'm just trying to educate you on some stuff. All right, so we talked about the bone loss associated with steroids. Okay. And taking vitamin D alone or with calcium seems to improve bone density in people with existing bone loss caused by using corticosteroids. Okay, weak and brittle bones, osteoporosis, we know that that's what that is, or osteopenia. Taking vitamin D by mouth along with calcium seems to help that as well. Let's talk about psoriasis, because some people have psoriasis. Did you know that topically applying vitamin D in the form of calcitriol, to the skin can help treat the plaque type psoriasis? Applying vitamin D along with the corticosteroids seems to work better than applying vitamin D or corticosteroids alone. Now remember, the research is still ongoing, but trial and error is how we know things. You have to do trial and error to know what works and what doesn't work. So if you're the guinea pig, I'm just saying, it's worth a try. If you are suffering with something and they say, well, we can try this and see, and it works for you, so be it. What works for one may not work for everyone, okay? All right. Taking vitamin D by mouth, though, for plaque psoriasis does not help. It's systemic. Your issue is on the skin, okay? All right. Now, let's see. Here's some good statistics, and this is infants, children, and adults about cavities. I'm just going to go through a few things that may help. Taking vitamin D2 or 3 by mouth reduces the risk of cavities by 36% to 49% in infants, children, and adolescents. Well, guess what? Teeth are? Are they not calcium? Yeah. So if you're vitamin D deficient, are you telling me that there's an increased risk or potential that if I had a cavity that my tooth may fracture or may spread faster, or of course now there's a lot of other things such as dental, oral health that but you don't want to be vitamin D deficient. Heart failure. Taking vitamin D by mouth can help reduce the risk of developing heart failure in some people. Not all people, some people. But you got to remember now, many people who have heart failure have kidney failure too. Remember, we talked about that. All right. But it does not seem to help patients who already have heart failure, but help prevent it. Bone loss in people with overactive parathyroid. That was one of the ones I said I didn't really want to get into. Okay. Infection of the airways. Taking vitamin D by mouth helps prevent respiratory infections in children. But taking vitamin D by mouth during pregnancy doesn't seem to reduce the risk of these infections in the child after birth, because it's got to go through the mama and all of that, right? It also doesn't help prevent infections in adults. Preventing tooth loss, tooth retention. Taking calcium and vitamin D3 by mouth appears to prevent tooth loss in elderly people. So listen to what I'm saying. The advantage is to not be vitamin D deficient. All right. So heart disease, we already talked about that. Trauma, giving vitamin D to people with low vitamin D levels who are in the hospital with a critical illness. It says it doesn't make them more likely to live, right? But it's kind of too late by that time, essentially. So what I'm trying to say is get your vitamin D level checked and make sure you're not vitamin D deficient, and keep your vitamin D level where it needs to be. All right. I'm sorry, I was distracted. Out the window. All right. Fractures, we already talked about that. High blood pressure. Taking vitamin D by mouth, it doesn't seem to lower blood pressure in most people with high blood pressure, but it may help people who have very low blood levels of vitamin D. Huh? Okay. That didn't make sense. Okay. Anyway, most of this stuff is controversial and a lot of it is linked together. Let me see. Side effects. Let's talk about side effects of vitamin D, okay? Because one thing you got to know, too much of a good thing ain't good for you, okay? So if you see on the screen here, it says vitamin D And what the doctor usually measures it as is a 25 hydroxy vitamin D level. So I put that up there so you'll see 25 OH is what they usually use to measure vitamin D. And that will give you a D2 and a D3, okay? And the reference range is 30 to 100. That's where you want to live, 30 to 100, okay? Optimal, like I said, is greater than 30. Insufficient is when you are 20 to 29. You're insufficient. You don't want to be insufficient either. And less than 20 is deficient. Less than or equal to 20. All right. And I do have on there that vitamin D is available over the counter. You can get cholecalciferol is the D3, ergocalciferol is D2. They're both available over the counter. However, high doses of vitamin D requires a prescription. So it depends on what your doctor can prescribe. They can say, take 1,000 international units a day. Or if you, okay, let me say this. The best vitamin D. So if a person is severely deficient, it's better to take ergocalciferol vitamin D2 if you are severely deficient. And what a doctor may do, they may give you 50,000 international units, which requires a prescription, and you'll take it weekly for maybe about 4 weeks, okay, to help you get your level up quickly. Depends on how deficient you are. So they may give you the ergocalciferol weekly for a few weeks, and then tell you once they get your level up to 20 or above, right? Well, 30 would be actually 30. They get your level up to 30. They may say, okay, now that we got you where you need to be, you don't have to take this ergocalciferol or the cholecalciferol in a high dose. You can just take the 1,000 a day, okay? And I'm going to talk about some incidences where there are some people who have bowel issues, especially like had a bowel resection or decreased absorption in their bowel. They may not get that absorption in the gut. And I'm going to show you the slide where shows you the production, how vitamin D is. Let's just go ahead. Let me go ahead and show it to you now. And I'll just keep talking as I show you this slide. Okay? And let me get rid of this so it'll be bigger. There you go. So this is metabolism of vitamin D in our body. And this basically shows you that food and sunlight are the external sources, what we eat and the sunlight. And that actually is, we get cholecalciferol. But remember, vitamin D has to be changed from inactive to active. And I got this slide up here, and I know it looks maybe a little complex, but I got it up here for you to look at the pictures. Not so much as, just look at the pictures. Don't look at all the big words and all the letters and everything. Just look at this and say, oh, I can get it from sunlight and I get it from my diet. But somehow, what I get from my diet and my sunlight, and the sunlight, has to be converted in my body. And that conversion from inactive to active takes place in 2 places. In my liver, that is a liver. If it don't look like one, it is. And it shows you kidneys. The little bean-shaped things with the little, those are kidneys. Okay, you got 2. See where it says active and it's pointing? All right. So there's the kidneys. and the liver. And you look at the liver and you've got your parathyroid. So there's a relationship between the parathyroid and the liver. And then you look at the kidneys, send the inactive activates it and goes into the gut, right? Where the gut then absorbs it, calcium and phosphorus. Okay, I hope this makes sense. And you see that little bone over there? Isn't that cute? So it also goes into the bone, keeps the bone strong. So I wanted you to see these are all the things in our body that are involved with vitamin deficiency. And guess what? They have a, let me see. If you invest in something, you are like, when you invest in something, you kind of take ownership or have some type of benefit of it, you know, because if my investment gains, then I gain, right? So the bone, the kidneys, the liver, all of that, the gut, all of that, okay? So I really just wanted to kind of show you that picture so that you would see the relationship or how all these things are related. Now, I'll let you go back and let me see. Where is IB at? There I am. All right. Come back and talk to me. Okay? All right. So, of course, like I said, there's side effects of stuff, right? So vitamin D is likely safe when taken in recommended amounts. Most people don't experience side effects with vitamin D unless too much is taken. Some side effects of taking too much vitamin D include weakness, dry mouth, nausea, vomiting, and others. Now, wait a minute before you even think too hard. Those same side effects are associated with a lot of stuff, okay? All right. So taking vitamin D for long periods of time in doses higher than 4,000 international units, which is equal to 100 micrograms daily, is possibly unsafe and may cause very high levels of calcium in the blood. Now, who should not take ergocalciferol? Remember when I said that there was the cholecalciferol and there was the ergocalciferol, which is the vitamin D2. And I told you that the ergocalciferol vitamin D2 has higher, it will increase your vitamin D level faster, higher. It's better at increasing vitamin D levels. So it depends on how low you are, which one your doctor may prescribe. So a person who has kidney disease, they are someone who, where did I write that at? Where's my paper? Some people should avoid need to be very, very careful about which one they take, because you do not want to have too high vitamin D levels. So if you have kidney disease, your doctor is going to be very, very specific in making sure that you do not take the wrong form of vitamin D. So it is the calcitriol is what should be used in people with kidney failure, because they themselves cannot convert because their kidneys aren't working. So that conversion of vitamin D from its inactive form to the active form, because they had kidney failure. The picture I showed you with the liver and the kidney. So guess what else? People with liver failure. So remember when we talked about liver failure not too long ago, even though we talked about fatty liver disease and cirrhosis. So just know that there are some people who cannot take that form. All right. So, hold on a second. Let me see something. Oh, okay. I just wanted to make sure that my husband wasn't sending me a message on my phone. All right. Precautions and warnings about vitamin D. When taken by mouth, vitamin D is safe. Like I said, I told you 4,000 international units, 100 mics a day is safe, right? But pregnancy and breastfeeding. Vitamin D is likely safe during pregnancy and breastfeeding when using the daily amounts. Do not use higher doses unless instructed by a healthcare provider. Children, vitamin D is likely safe for them as well, but it is possibly unsafe to take vitamin D in higher doses long term. And remember now, most of what babies get already fortified with vitamin D. Now, here's some reasons why you want to be careful. So, hardening of the arteries. Remember last week when we talked about atherosclerosis and I talked about if you had hardening of the arteries? Didn't I say that calcium build up, plaque build up? Remember we talked about that and cholesterol and all of that? And things getting calcified? So didn't I tell you just now that calcium and phosphorus make bones strong? So if you have hardening of the arteries, guess what you don't want to do? You don't want to take vitamin D if you don't need it. Because taking vitamin D could make this condition worse. Okay? Especially if you have kidney disease. It's tricky. Whoo, I hope I ain't losing nobody. So let me tell you what my goal in this is. The goal is not that you remember all of this information. The goal is that a red flag goes up. Like, I can't remember exactly what she said, but I know that there's something, there should be a warning that I should remember. Don't think that I'm talking about all this stuff, and trust me now, I'm making it really simple compared to what it really is. Now, if I was presenting this to a colleague, it would be totally different. So I'm trying to present this to you to make the dog ear goes up, the tail goes up. Like, wait. I've heard that before. Wait, there's something funny about this. Dog, ain't there something that we got to be careful with? That's the goal. That's the purpose. So, there is also a type of fungal infection called histoplasmosis. Vitamin D might increase calcium levels in people with histoplasmosis. This could lead to kidney stones and other problems. Think about it. If you have calcium oxalate kidney stones, you may not need to have a high vitamin D level. You might need just to be optimal, but you may not need that supplement. You don't need to be deficient, but you don't need to be too high either. Get to the 30 and stay there. Okay? So, if you are on vitamin D because you were deficient, okay? And after being deficient, you're no longer deficient, and you notice that you're starting to produce stones, kidney stones, think about it, okay? And if this is not pertinent for you, there may be someone you know of that suffers with these things that you may want to ask them about. Get your vitamin D level checked. What if they in the sun all the time? They garden all the time. All year long they out there getting sun. And they keep making calcium stones. They drink beer and he in the sun all the time. Ding, ding, ding. I'm just saying, come on now. You pull stuff together. What I'm saying to you, the more you know, the more you're able to take, that thinking cap thing. Like, I wonder. There's nothing wrong with thinking. And take what you're thinking and find information to piece the two together. That's what I'm saying. Okay. If you have high calcium, now that high calcium could be because your parathyroid gland, I have to, let me see, didn't I showed you the parathyroid gland. Where's my picture? There it is. See, the parathyroid where it says PTH secretion, that's your parathyroid gland. They little teeny glands on your thyroid. Okay? That can cause you an issue too. All right? All right, let's move on. Let's see, we didn't talk about lymphoma. Vitamin D might increase calcium levels in people with lymphoma, which is a form of cancer. Kidney stones, we talked about that. Kidney disease, we talked about that. Hardening of the arteries, we talked about that. I'm just trying to see, what did we not talk about? A disease that causes swelling and inflammation, we talked about that, in body organs, usually the lungs or lymph nodes, like sarcoidosis or lupus or something such as that. Vitamin D might increase calcium levels in people with sarcoidosis. This could lead to kidney stones or other problems. Vitamin D use it cautiously. Tuberculosis is another. Vitamin D might increase calcium levels in people with TB. All of it says can lead to kidney stones. Now, let's talk about interactions. What can vitamin D interact with? Now, these are some things that, I really want to talk about. And then I'm going to go to a little bit of more information. Measurement, interpretation, clinical application. And I'm going to talk fast. And then I want to talk about the trials and future of vitamin D research. Okay? I got time. All right. Have faith in me. Aluminum. Now, aluminum hydroxide, things such as that, your, not Pepto-Bismol. What's the other one that's aluminum hydroxide? Oh, and it's an antacid that we take. It's in a blue bottle. Anyway, antacids can have aluminum in them. Let me see if it tells me here. I can't think of the blue bottle. Aluminum is found in most antacids. Let's just say it that way. Vitamin D can increase how much aluminum your body absorbs. Aluminum ain't good for you, okay? This interaction might be a problem for people with kidney disease especially, because they can't get rid of aluminum either. And they don't need neither one. You should take vitamin D 2 hours before or 4 hours after an antacid so that you don't increase the absorption of the aluminum. 2 hours before or 4 hours after. Okay? Let me see. Okay, hold on. Let me go to this next. Oh, digoxin. Not too many people on dig anymore because there's other newer drugs for heart failure and for arrhythmias. Digoxin was the drug of choice back in the day for congestive heart failure. Okay? But digoxin, there's still a lot of people on dig though. It interacts with vitamin D. So remember, now I'm giving you information. You may know people who take these medicines. Taking vitamin D along with digoxin might increase The effects and side effects of DIG. It's very easy to get DIG toxic. And the side effects of DIG toxicity are not good. So, and I'm not going to get into all of that, but just know, vitamin D increases the potential for DIG toxicity. If you are taking digoxin, talk to your doctor before taking vitamin D supplements. And I think there's a time frame, such as like with the aluminum, but I'm not going to take the time and research it right now, but I just need you to know. So first of all, let me say this. I take care of residents in nursing homes. Many times when my residents get sick, do you know what I spend more time doing? Going through their medications and drug interactions, potential. When I say polypharmacy and I say people make themselves sick, maybe I shouldn't say it like that. If your doctor does not know everything you take and how you take it, you could be getting sick and not realize that it's how I'm taking my medicine that's making me sick. I shouldn't take that with that. But I go on and take them because I ain't got time to be taking all that all day long. So what you have to do is know enough about your medicine, talk to a pharmacist, and let the pharmacist sit down with you and tell you what to do. My job, insurance company that I work for, offers that to me. And even though I'm a nurse practitioner, we went through my medications. Guess what? I got an A+. No, I got an A. And after I got through talking to them, I ended up with an A+. There was only one thing that they had to help me, or they helped me with, and it was I was spending too much money and I didn't know that I could get it some things cheaper. So I did really good. Okay, practice what you preach. All right, now diltiazem or cardizem is another drug. It does interact with vitamin D. I guess I should have put these up here, and I may, because Lipitor, atorvastatin, cholesterol pill, thiazide diuretics like hydrochlorothiazide, Kalan, verapamil, and diltiazem and digoxin all interact with vitamin D. Diltiazem or cardizem, vitamin D helps your body absorb calcium. Calcium can affect the heart. So that's the reason why it's a calcium, the way it works it's a calcium channel blocker. So these drugs, the way they work in the heart, I don't know if you guys remember me talking about the calcium channels and electrolytes and minerals and how they affect the way our heart beats. So remember, if vitamin D causes calcium to be absorbed, it can interact with those medications and make them more effective, like work better than they're supposed to, and cause problems. Okay? All right. And it actually says that large amounts of vitamin D may decrease the effects of diltiazem. So it won't work as well. Same verapamil. You shouldn't take large amounts of vitamin D if you're taking verapamil. So vitamin D decreases the effectiveness of verapamil or Kalan, diltiazem, or cardizem. These are generic and trade names. Same drug. Diltiazem is cardizem, and verapamil is Kalan. Vitamin D decreases their effectiveness. Thiazide diuretics, water pills. Vitamin D helps the body absorb calcium, like I told you. Some water pills increase the amount of calcium in the body. Taking large amounts of vitamin D along with some water pills might cause too much calcium in your body. So this is what they're saying about the thiazide diuretics, which is hydrochlorothiazide. Okay? Atorvastatin or Lipitor. This is a cholesterol pill. Vitamin D might decrease how much atorvastatin the body absorbs. So you may think your cholesterol is being lowered, but it may interact with it. So for example, you may need to take another cholesterol medicine like pravastatin instead. I'm just telling you, okay? Now, anyway, I think that's enough of the medication. There's a lot more that we could go through, but I do want to essential vitamin D is also a central nutrient in fish and eggs and fortified milk. Okay, if you can eat those things. All right. So I just want to make sure. And the last thing, okay, that's enough of that. I did want to quickly go through and see, did I miss anything? We talked about vitamin D being a sunshine vitamin. We already talked about it promotes bone health. I'm just trying to see, was there anything I missed? Nothing there that I need to kind of mention. We talked about vitamin D2 and D3. I don't see anything on that page I missed. Yay! Woohoo! Woohoo! All right. The last thing. All right. Understanding vitamin D and your heart health. Now, you know this is where I was going to end. Because without your heart, everything else is gone. The brain dies if you can't pump blood. The heart's a pump. So you need your heart. The idea that higher vitamin D intake could improve heart health came out years ago. And it was an observational studies that found people with higher blood levels of vitamin D had lower rates of heart disease. But there were randomized controlled trials, including one called VITAL, VITAL. There were 25,000 adults enrolled in this study. And it found that high-dose vitamin D supplements did not prevent heart events. Like, if there's damage already done, so if damage is already done, the vitamin D is not going to stop it. But what you can do with the vitamin D is help slow down and prevent damage, right? The calcium, plaque, the buildup in the blood vessels. Okay? Let me see. So there is a relationship. What they're saying is people who had higher vitamin D levels were less likely to have cardiac events. So guess what? The little simple thing. They're more active. They're out in the sun, or they're walking. They're doing things that increase their cardiovascular health. So not that it's actually the vitamin D, but it's what they do. All right. And then it says Of course, there's the incidental sun exposure that people get that have more outdoor engaged in physical activities. Diet is another. They eat healthier, omega-3s and the vitamin Ds. They eat fish and other nutrient-dense meals. Support heart health and tend to be higher in vitamin D. Inflammation is one. Levels of inflammation can serve as signals of disease. And since vitamin D can bind to a protein that's more likely to be depleted from inflammation. Yep. All right. I think we did pretty good on explaining that for the first time in your life, having a D+ will pass. You will pass the test. So for the first time in your life, I want you to concentrate on making a D so you can pass. Okay? All the things that we have talked about, understand. Talk to your doctor if you've never had your vitamin D level checked. Some people assume, and I'm going to say this, you can be young African American, not 60, 65 years old, and be vitamin D deficient. And because you're young, nobody checked your vitamin D level. There are many times my doctor may have said, well, you know your insurance won't pay for this. My insurance ain't going to keep me alive. I'll pay for the stupid test. We pay for other stupid stuff. Well, let me not call it stupid stuff, but we pay for other things. Have a good time. We go to a Janet Jackson concert. Get your vitamin D level checked. Janet gonna be there, you enjoy the concert. I ain't knocking nobody, because she is coming to Charlotte this month, I think. And, but get it checked. You can be a very dark-skinned person or a person who works in a dungeon, in a basement, a person who hardly ever gets any sun exposure, and be vitamin D deficient and not know it. And like I said, just because you're young don't mean nothing. You could be very vitamin D deficient and not realize it. All right, well, God bless each and every one of you. This is Dr. Anna Shaw Devlin for SHEM Ministries, and this is our SHEM 2 night, our Spiritual Healthy Enlightenment Mandate Ministry. And as I promised you guys, let's see. I got my business. First of all, my references, overview, uses, side effects, precautions, interactions, dosing, and reviews. And that was WebMD on vitamin D, and evidence-based debate on health benefits of vitamin D. Okay? Those are a couple good resources that I used. I know it's kind of small, but I do need to let you guys know that I don't pull all this stuff out my head. All right. Here is my business card. I know it might be a little difficult to see it. I did the best I could. We're going to get it professionally done in our advertisement or whatever. But for right now, we doing it. Ask Anna, PLLC. And at that time, Dr. Anna Shaw Kirk established Ask Anna. And then we met, married, and merged with SHEM Ministries. And we're Dr. Anna Shaw Devlin. But here is the phone number, 336-355-6472. That you can contact me, leave me a message. Please allow time for me to respond. The web address is a work in progress, and eventually we will get that, where we'll put our videos up and you can easily go and just click on a video and watch. Okay, where you can, go back and watch videos. You don't have to scroll back through, and we're going to fix that. That is going to happen this year. That will be soon. And then we have our Gmail. Okay, you got all of that. These are ways to contact me. And my two favorite scriptures, number 1 is Proverbs 4:7. With all thy getting understanding. You make sure you understand these things, okay? And that's the purpose of what I do. And here's the back of the card. Same thing with the number. And Hosea 4:6. My people are destroyed for a lack of knowledge. These are the two scriptures that I live, govern my medical ministry by. Okay? So, Father, right now, in the precious name of Jesus, we thank you, we praise you, we glorify you for allowing us to deliver what you have given us to deliver to your people. And Father, I ask that they take this information and use it for their benefit, God. Help them to understand the need to fix every little simple thing so that the big things don't tear up. That's right. When the little screw falls out, get the screwdriver and screw it back in, because if you don't, another little screw falls out. Another little screw falls out. And before you know it, the whole back plate fell off. Okay? And then it's going to cost you a lot to try to fix it, if it can be fixed. Just think about it. Father, bless your people like never before, to protect and care for themselves and the loved ones in their lives. Take this information and share it with others. Okay? God bless you, and we love you. Adios, amigos. And as my lovely pastor and husband says, don't just be blessed, but be a blessing to God's people. And guess what doesn't cost a dime? Spreading the word. Giving people information. Free. We give it for free. And I thank you for watching. God bless.